Ladies and gentlemen, 70 years ago, our most respected medical institutions convinced us to abandon the natural fats that had sustained our health for generations and to start eating factory-produced vegetable oils. And we follow their advice on such a grand scale that it amounts to a massive public health experiment. Today I want to show you the results of the experiment so that you can see that if you're looking to improve your health in any way, to lose weight, reverse diabetes, get off medications, prevent getting cancer, prevent heart attacks, avoid dementia, or really not have to deal with any of the medical health conditions that you might be worried about that might run in your family, then it's time to learn that Harvard never had your best interests in mind. And you need to stop participating in their experiment. Today, I want to convince you to say goodbye to vegetable oils because it will save your life. These are my financial disclosures. So I'm a board-certified family medicine physician. I am an author of several books on nutrition and health. I advise a couple companies using my science and medical expertise. And here we go. Let's talk about the experimental diet that we've been following. So 70 years ago, we got this strange directive to stop eating these things called saturated fats and start eating more polyunsaturates. We didn't really know what that was, so we got some very more specific instructions. Instead of steak, eat chicken. Instead of chicken legs with skin and fat under the skin, eat skinless chicken breast. Instead of eggs, have egg whites. Instead of butter, have some kind of low cholesterol spread. Instead of cream, use creamer. There's no cream in those little coffee things that are called creamer. Instead of whole milk yogurt, use fat-free yogurt. And I challenge you to find any flavored yogurt that has full fat dairy in there. It's usually skim or low fat. Instead of regular bacon, eat turkey bacon. Instead of whole milk, go after skim or just 1% if you're really feeling sinful. And instead of having your fries in tallow, have them in some kind of vegetable oil. And that's a really big one because we get a whole lot of, because there's a huge difference between deep frying in tallow, pan frying in tallow, and frying in oil. And the other thing that happened is because we were told not to do butter and not to do tallow, we ended up having to find something to cook with, and olive oil being really expensive, we didn't usually use that. Most people go after a kind of vegetable oil, which is about 1/20th to 1/50th the cost, depending on what kind of volume you buy it in. And the other thing is that these vegetable oils, usually, very often you'll see like a little heart logo on there. They actually come across as like the healthier alternative. Not only are they cheaper, but they're also somehow better for you. So you'd be stupid to get olive oil. So these are the high polyunsaturated vegetable oils, also known as seed oils, that we've been eating in increasing quantity over the past 70 years. PUFA stands for polyunsaturated fatty acid. That's the reason this is such a radical experiment, because we would never have consumed this quantity of polyunsaturated fatty acids in our entire history. So these top 6 here are the ones that you'll find listed on food labels: canola, corn, cottonseed, soy, sunflower, safflower. And the 2 at the bottom, grapeseed and rice bran, we mostly just find those in restaurants where, you ask the chef if they're cooking with olive oil and they'll proudly tell you, oh no, we use grapeseed, it's healthier. Not true. A lot of folks have asked me, does that mean soy and corn and sunflower seeds are bad for you? And the answer is absolutely no. It's the processing and factory refining and all the heat and chemicals and pressure that mutate the fragile polyunsaturated fatty acids. They're fine when they're in the seed. Let's take a look at what actually vegetable really looks like. So This here is crude vegetable oil before it's been refined. So there's lots of steps in making vegetable oil, and the first series is just extract it from the seed. So when you extract it from the seed, you use a lot of heat and pressure. Sometimes you use chemicals. You can't use chemicals if you're going to call your oil organic. But this is actually from an organic factory. It looks like brown kind of vile sludge. It smells horrific and it tastes disgusting and is in fact inedible. It is inedible. It is also toxic. So over 100 years ago, when they first, before they learned how to refine this stuff, they fed it to the cows, the animals first, to see if it was edible, and it actually killed them. So over the next 100 years, they've been working on the refining process to remove all of the toxins in here. And unfortunately, that is impossible just because of the nature of the chemistry. How do I know that? Well, this is Dr. Decker, who is one of the most well-respected oil chemists in the world. And oil chemists are an entire industry that is devoted largely to trying to minimize the toxicity of vegetable oils during the process of extraction and refining. And this talk that was presented at the American Oil Chemists Society, which is where you can meet a lot of oil experts, explained that for 150 years they've been trying to minimize the toxicity, but have really not been able to get it to get the toxins out. And so that when you buy corn, canola, cottonseed fresh on the shelf, there are already quite a variety and significant amount of toxins in there. And they're still looking for ways to improve it. But I think at this point, it's pretty much proven like not likely to happen anytime soon. So the other thing that oil chemists will tell you about is that when you cook with these things, especially if you put them in a deep fryer or you pan fry with them, many more toxins develop. And that is perhaps a bigger problem. But the sheer volume that we are consuming is a problem too. And that's what I want to cover today. So here is just a screenshot from a Twitter account that I follow, the Seed Oil Disrespecter. And he posted something from somebody who follows him about canola oil really is engine lubricant. It is used as literally engine lubricant. And this may seem like a cheap shot, but how can somebody at Harvard seriously suggest that instead of eating butter or coconut oil, we use something that could also is used as engine lubricant? And oh yeah, what did I just tell you? They've been trying to make it not toxic for 150 years and they haven't been able to. So Harvard says, never mind all that, just eat it. We tell you it's better than saturated fat. That's not cool. So here's how it gets into your body. This is why we have really been almost forced to enter this huge experiment, right? We don't even know we're eating this stuff. You might shop at one of those expensive organic grocery stores and buy organic, for example, salad dressing, and it looks like you probably would assume this would have olive oil in there, but if you look at the ingredients, you see that it's vegetable oil. And what kind of vegetable oil? Well, it could be soy, it could be sunflower, we don't know. Why don't they know? Well, because there's no taste in any of these things, so it really makes no difference. It's so refined that it doesn't have even any flavor. And also chemically, really, they're the same, almost identical. So they're all substitutable for each other. And you really have to read absolutely every single label that on anything that you buy, because even when they say olive oil on the front, if you look at the ingredients, which isn't easy to do, that's why this is blurry, it's teeny tiny writing. The first oil here is Not olive oil, but soybean oil. Olive oil comes in second. So there's apparently no truth in advertising on food labels. If you are trying to do something like lower your cholesterol and you go after what you think are these healthy spreads, you're going to be eating vegetable oil. America's most popular snack cracker is Ritz. And what's in there? Multiple different types of vegetable oils that are hydrogenated and not hydrogenated. And both are bad for you. The hydrogenated oils are unhealthy because there's something called trans fat in there. And then the regular vegetable oils are unhealthy because they have about 20 different types of toxins in there, including some trans fat, just not made on purpose. Man-made trans fats are differently unhealthy, but avoid both of them. If you go out to a restaurant, you are eating seed oils. You're not getting olive oil when you sit down at one of these sit-down chain restaurants. And certainly you're not getting any healthy fats when you go through a fast food restaurant. It's all vegetable oils. Even when you go try to do some fine dining, chances are really good that you're not getting olive oil and butter. Whenever possible, restaurants now are so on the edge of profitability, they have to cut every single corner. So olive oil being 10 to 20 times more expensive, of course they're not going to do that, especially when nobody knows that there's these alternatives, this rice bran and everything, are unhealthy. In fact, a restaurant may even tell you they cook with olive oil, and because there's this tricky thing now called an olive oil blend. And what an olive oil blend can be is something with 1% olive oil and 99% some kind of vegetable oil. And it'll look for all the world on the container, unless you read this, like it looks like olive, but it's not. It's a blend. It says oleoro or something like that. So even when you're going to a restaurant and they tell you they use olive oil, you have to say, okay, well, is it a blend or not? And I've found that more than half the time the answer is yes. The best blends that there are 50-50, and the most common blend that I've heard is 70% vegetable oil, 30% olive. So with all these different sneaky ways of getting us to eat vegetable oil, we are eating an astronomical amount. This is a record of statistics compiled over the past 100 years of how much we have been eating over the years. And if you look back at 1909, we're eating maybe 2 pounds, and these things really were not in the food supply. And now we're eating almost 80. So just to excuse my face here, this on the right is pounds per year, per person. So like 2, 3, 4 ounces every single day of these oils, amounting to over 600 calories. So it's a huge portion of your diet. And I'm bringing this up because so many times people tell me, oh, Dr. Kate, it's good that, olive oil is good because that's all I cook with at home. When I show them this list, and I have to point out that, oh, no. There's all these other ways that they're getting into your body unless you are specifically avoiding them. So here is like the real crux of what the experiment looks like. Okay, so the yellow line is that we are eating way more vegetable oil, starting out maybe like 60 times more than what we were eating 100 years ago. And in terms of the traditional fats, butter, lard, and tallow, we're eating maybe 25% of what we were eating 100 years ago. So this is the crux of the experiment, because we have switched out traditional fats that were heat stable, that don't deteriorate or oxidize when they're heated, when we cook with them, that don't like form this massive milieu of toxins. We've stopped eating those. They also have vitamins in them, by the way, and natural antioxidants. And we've started eating just an incredible amount of polyunsaturated fat rich processed oils, which are a huge problem because oxygen attacks polyunsaturates and turns them into a wide variety of different kinds of known toxins, carcinogens, neurotoxins, and so on. And if you haven't heard anybody else at this conference speaking, I encourage you to listen, because they will tell you all the different types of varieties of toxins that these oils deteriorate into. And so really, literally, this is the largest change in our nutrition that we've made in these past 100 years. Bigger than anything in all of our entire human history. More profound. Because we're going from something that was natural to something that is not only unnatural, but full of toxins, and continues to create toxins in our body, continues to deteriorate into new toxins in our body. So who's been able to escape this experiment? Well, the ultra rich, because they have personal chefs and they go to the best of the best restaurants where the chefs source the best of the best. And they don't need to cut corners because they get to charge what they're worth. And so by luck, the rich people who are already super lucky, they're lucky in one more way. They get to skip all these toxins that the rest of us are eating. Whether they know it or not, that's what's happening. There is another group of people that have also escaped the experiment. I love this little group of people. The people who love to cook and the people who have kept traditional family recipes alive. They've escaped the experiment because traditional family recipes don't use vegetable oil. They use traditional fats, the very kind that Harvard tells us we need to get rid of. So, unfortunately, there are very few people who are lucky enough to have somebody like this in their lives, to have grown up with somebody who taught them the way to cook traditionally. Because, here's why. It's not just that cooking is hard and cooking is messy and it takes time out of your life and it's a skill that nobody prioritizes anymore. It's not just that. Here's kind of really the death knell. If you are told that an essential part of your traditional family recipe is going to give you a heart attack, how can you be excited about making it for your family? You got to feel a little guilty. And so that's how these things are dying out. And it's a real tragedy. All right, so what? So what if Harvard told us to, eat some toxic food? What is that really doing? Well, here's the results of the experiment. For those of us not in the top 1% or not lucky enough to grow up with a granny or a mommy in the kitchen all day long, this is what it's done to our bodies. This is a graph comparing modern body fat to body fat 100 years ago in terms of its polyunsaturated fatty acid percentage. So there's two things, right? Now the average person has more body fat in general, but that's not the real problem. The real problem is that the chemical composition of our body fat is now 6 times higher in these unstable, easily oxidized polyunsaturates than ever before in history. And it's higher than our bodies are really designed to handle. And I'm going to show you that that's the case because, for one thing, we're all getting really sick. Type 2 diabetes is a different disease than type 1 diabetes, and it did not exist before seed oils were introduced into the food supply. It wasn't even described until 1938, and it wasn't really tracked until the late 50s, so that's why the statistics start around 1960 here. And we did have the tools to diagnose it. It was very simple. We've diagnosed type 1 diabetes. It was a much more rare disease. We diagnosed that thousands of years ago. It's the same method, really. You just taste someone's pee. Doctors can be devoted. Sometimes, well, maybe we were more devoted in the past. Anyway, So what this graph is showing is that the diabetes type 2 and prediabetes did not exist until there were already quite a flood of seed oils in the food supply. And as we've been eating more seed oils, our development of type 2 diabetes and prediabetes, and also presumably its cousin insulin resistance, has increased in almost perfect parallel to our consumption of seed oils. I have the references for how I compiled this data on my website here at the site at the bottom. And so it's really significant to look at type 2 diabetes, not just obesity, but specifically type 2 diabetes, because type 2 diabetes is associated with pretty much every other chronic disease, bad disease, things that I used to see in clinic every single day. Now I do a telehealth, so I'm not in clinic. Really the A to Z of diseases. So what this means when I say associated is that if you have type 2 diabetes, you are at risk, higher risk of getting all of these other diseases. Okay, there's some scary things on here, including things you might not necessarily think, like fragility fractures in your bones, Parkinson's, complications of pregnancy. And it works the other way too. If you've had any one of these things, it might be because you're on your way to developing type 2 diabetes. And chances are good that you already have prediabetes, since half the people with prediabetes are undiagnosed. And chances are extremely high that you have a precursor to type 2, to prediabetes called insulin resistance that doctors are not trained on how to diagnose, but it can be done easily with a simple set of lab tests. And the other thing that's important to know about this list is that if you have any one of these diseases, because it's the same underlying cause behind all of it, then you are likely to get all of the others. You're more likely to get any one of the others. I want to show you just some specific other statistics about child health. So brain tumors have gone up. These are malignant childhood brain tumors. Young adult diabetes has gone up it's all in parallel with seed oils. Childhood asthma, birth defects, like I mentioned, young adult depression, pretty much anything that you would want your child to avoid, unfortunately, is going up. Obesity, so this statistic has actually children as young as 2 to 5, and it's more than double just in this time period. And you'll notice that these time periods seem a little bit random. It's because our government does not keep very good statistics. We're not like Finland, where they have like a universal system. So it's a little bit random what I could find. Nearsightedness. Now, how on earth is that related to diet and vegetable oils? Well, it turns out that vegetable oils actually deplete your body of antioxidant vitamins like vitamin E and vitamin A. And these vitamins are essential during pregnancy and early development for the normal formation of a lot of our organs, including the eyeball. So just like it's associated with birth defects, it's associated with abnormal vision, all kinds of eye problems. Schizophrenia, which is something that usually affects young adults. Inflammatory bowel disease in children under 16. Migraines in 7-year-olds. Adolescent obesity is really skyrocketing, and it's even worse. Again, this ended in 2006. And then autism. Now, this one is a little bit shocking, and some of it may be increased in diagnosis, but is definitely also increasing for real, right? Not just that we are diagnosing it more. But what I'm really upset about is that there have been studies looking at autism being caused by something in the environment, right? And they've looked at literally everything except seed oils. They've looked at glyphosates, they've looked at soy protein, they've looked at mercury and lead, and they've looked at vaccines, they've looked at everything except for the most important, the biggest nutritional change, and frankly, the most likely suspect, which you'll see when I get to, if you watch my second talk here. So I wanted to show you these statistics in children, actually, because a lot of folks, when I first started talking about this, almost 20 years ago now, would come back and say, well, of course we're having more diseases, we're living longer. So these are statistics in children. This is real. This is not because we're living longer. And this, what I'm showing you right now, this slide, is that millennials' health is starting to decline at the age of 27. So where people used to start expecting their health to be pretty good until they retired at 65, that's now been dialed back by decades. And people are starting to feel their age when they're 27, in the prime of their, supposed to be the prime of their life. Now, one thing I just want to bring up about this is that this does come from Blue Cross, and there might be some like questionable conflicts of interest here just because they want to make it look really bad so they can justify the rate hikes, right? But in my experience, I've found that insurance companies really do keep pretty good statistics, certainly better than the government does. All right, so here's the really important and I think interesting and fun part of the talk, the discussion. What's wrong with this conclusion? Why is it not vegetable oils that are causing all this disease? Well, for one thing, the first objection I've been getting is correlation is not causation. Now, that's a really good point because correlation is not causation. You need to have some kind of a plausible mechanism linking the two. And, well, okay, I've got that. What is the mechanism? Well, it's got to do with the fact that our body fat composition is radically different than it's ever been in history. We are consuming polyunsaturated fatty acids that are exposing us to this thing called oxidative stress. Oxidative stress is the mechanism of that A to Z of diseases that you saw in the earlier slide. Oxidative stress is what ages us, and oxidative stress is usually ultimately what kills us. So if we have more oxidative stress caused by polyunsaturated fatty acids in our body fat, it's like a no-brainer that we're going to have more sickness and more metabolic disease and more disease of all kinds. So the mechanism linking the consumption of these factory oils to disease is oxidative stress. And I think it's a really important concept to understand that when our body fat has this radical different composition, basically our body fat turns into an enemy of the state, really. And that's why I am really actually honored to be able to do a second talk here at this summit called How Our Seed Oil Diet Turns Your Body Fat into a Toxin-Generating Machine. I'm going to go into detail about how the oxidative stress basically deep fries our tissues slowly over the course of our lifespan. Okay, objection number 2 that I get is it's not the seed oils. There's something else in the diet that's causing it. It's not the seed oils, just a coincidence here. So I would ask you, the objection really is more that our diet has changed in so many ways. And that's true. It has. But here's my response. What is a better correlation than the seed oils? So this looks at the usual suspects that at least Harvard and a lot of people who are really into keto and low carb bring up, which is saturated fat and carb. So saturated fat, pretty much a flat line. no correlation between saturated fat and type 2 diabetes or prediabetes. And remember, this means that there's also no correlation between metabolic or diet-induced heart attacks or kidney problems or any of the other things on the A to Z list, because they all run together. So not saturated fat, carbohydrate down here, which carbohydrate includes sugar. Sugar is a type of carbohydrate. Also does not correlate as well. And things like gluten, right? So gluten is part of wheat. So if we really haven't increased our carbohydrate content, our consumption, we really haven't increased our wheat and our gluten consumption very much. And if you look at the data on flour, it's actually, according to some statistics, less. Even though the gluten itself might have increased a little bit, it's nothing like the massive increase in our seed oils. So those don't work. And then there's one more usual suspect I want to bring up, which is red meat, right? Because again, this is coming from Harvard. Red meat makes us so unhealthy. Red meat makes us fat. Red meat causes diabetes. Red meat causes cancer. So again, another flat line here. We really haven't increased it significantly, and it certainly does not correlate with the rise in type 2 diabetes. And, one thing that I want to point out is that correlation doesn't imply causation. You need to have that mechanism linking it. But without a correlation, there really can't be a causation. There can't be a causational relationship. When where one variable changes and another one doesn't. That there can be a correlation when no variables change, technically, but when they are changing in relationship to each other, when the saturated fat level is a flat line, it can't be the cause of type 2 diabetes. When the carbohydrate consumption is a flat line, it can't be. How do you explain it? So correlation is necessary for causation. And the best correlation between seed oils and type 2 diabetes and all metabolic diseases, obesity, is the seed oils. The correlation we're looking at is the best one. Sorry. So, okay, so this is a photo from a friend of mine who's making a documentary traveling all around the world to look at the relationship between the diversity of human diets around the world and health. And what he's showing us here is a photo he took from Tanzania in a little store in the middle of nowhere, showing an aisle full of seed oils. And what he's discovering is that there's really almost no corner of the earth anymore that is free of these seed oils. And this is like a row entirely. And look at, they've got these 5-gallon tubs here down at the bottom, just so you never run out. Okay, so the third objection is my favorite because it's so ridiculous. It's simply that there is no correlation because Harvard says that there's no correlation. When Harvard does studies on seed oil, it actually is protective against type 2 diabetes. So let's see how they do that. How do they keep us from seeing the big picture? This is the big picture. And the way they do it is by showing us a very confusing set of slivers of lots of little pictures. In other words, a bunch of statistical analysis. They don't want you to see the big picture. They show you little slivers of reality. And what I'm showing you here is one of many thousands of studies that Harvard has done over the years that they have been selling us the idea that seed oils are healthy. It's not like I had to dig very hard to find this one. So let's take a deep dive into this article. Put on your thinking caps because there's a lot of, they're trying to confuse you, and so there's a lot of jargon here. Okay, so first of all, the article says it's going to be talking about dietary fats that can prevent you from developing type 2 diabetes. And what we're looking at right now is a paragraph called the abstract, which is the summary of the article, supposed to actually accurately reflect the contents of the article so that a busy doctor doesn't have to read the full thing. And what they're saying that this article proves is that evidence suggests replacing saturated fats and trans fats with unsaturated, polyunsaturated, or monounsaturated fats has beneficial effects on insulin sensitivity. And okay, so just let's pause right there. What all that mumbo jumbo and jargon is that they're saying eating more seed oils has beneficial effects on insulin sensitivity. Stop right there, because they said they were going to be talking about diabetes, type 2 diabetes. So they're already redirecting us. They're already having to bridge a gap here by saying, and is likely to reduce risk of type 2 diabetes. If that's what their evidence showed, then they should retitle it Dietary Fats and Prevention of Insulin Insensitivity. So what they're doing here is they're making you think about one thing, and they're redirecting you. They're controlling the conversation. They're promising one thing and they're delivering something else. If you have ever been in a car seat with a used car salesman who's trying to get you to buy this car, you get this feeling that this guy is not telling you the truth, maybe. And you don't exactly know how to put your finger on it, but you want to get out of the car. That's the feeling that I get every time I read one of these studies, because they're doing that to me. They're doing that to the American public, because doctors don't really understand exactly how they're making us think one thing that isn't true. They don't know that. They're trusting Harvard. And what I'm saying is don't trust Harvard, because they are used car salesmen when it comes to seed oils. They're in bed with seed oils. It's a syndicate. So when you look at, that was the abstract, supposed to be an accurate reflection of the article. Let's take a look at a section of the article. This article reviews a number of studies and refers to a number of studies. And so this is the 26th article that they're talking about right now, which is a really big, very important study, actually, called the Melbourne Collaborative Cohort Study. Huge study. And that study, what do they say that study says? First of all, they can't just lie about that study, because the people involved in it might call them out, right? So they have to find a way to make you think that the study said what they want you to believe it said. Okay, and here's how they do that. So let me read you what I highlighted here. There's a couple sentences, and I'm going to read the first part of the first sentence, which is plasma linoleic acid was inversely associated with diabetes incidence. Okay, now plasma linoleic acid is not dietary linoleic acid. But what it's making you think is that more linoleic acid is protective from diabetes, because the association is the opposite. The more you ate, the less you had diabetes. Okay, so it's making you think something that has to do with your diet, but it's actually not got to do with your diet, because you can't control your plasma linoleic acid level with your diet. Not very easily. In fact, though, it's not just linoleic acid. There's a lot of things that are regulated. Your body regulates stuff, and when you actually look at, here's another thing that they did. Technically, this study looked at plasma linoleic acid, technically, but actually what they really looked at was phospholipid, which is a subset of the plasma linoleic acid. And that, ladies and gentlemen, is entirely beyond your control. Well, not entirely, but it's not something you can do anything about tomorrow. Not like diet, right? So let's look at the second half of the sentence now. What does it say? But dietary intake of linoleic acid showed a positive correlation. Now, wait a second. This whole study is supposed to be about dietary fatty acids, right? So this first part of the sentence was a complete misdirection. They're trying to make you think that it's related, that it's not a misdirection. These two things have nothing to do with each other. And this is just a tactic to confuse you. And it it works because some very smart people buy this stuff. They believe it. People who have PhDs in nutrition, they kind of gloss over the fact that this is not, this first part of the sentence has nothing to do with the title and really nothing to do with the second part of the sentence, but they believe it does. And then, though, here's what they have to do to downplay. This second thing says dietary, that I just read, basically goes along with this. So this study, 26, actually showed that the more seed oil you eat, it actually supports the idea that the more seed oil you eat, the more type 2 diabetes you get. So what they have to do so that you don't think that for more than a tenth of a second is immediately call it an aberration, a contradictory result that's due to errors in the study. What kind of errors? Self-reported dietary intake. Well, hello, that's what this whole article is about. So every single thing that you cite in here is subject to error according to this statement because it's all about self-reported dietary intake. Most of these studies are not people being fed linoleic acid. So what is my response to this claim that there is no correlation? This is a propaganda poster. And it's obviously not true. Soldiers don't eat babies. This is obvious propaganda. What I'm saying is that Harvard's School of Nutrition and the American Heart Association and many other people who get money from seed oils are also just propaganda, and we shouldn't take it any more seriously. Unfortunately, it's very hard to see the propaganda, unlike this poster here, which is obviously silly, because it started so long ago, and it's such a complex and convoluted set of relationships right now. And we've heard it all for so long, starting back here 70 years ago. The whole propaganda thing against saturated fat began almost 70 years ago with this gentleman, Ancel Keys, who came up with the idea that saturated fat was bad for us. Basically, the way he put it, that made it unforgettable, really, was he said, saturated fat builds up in your arteries like hot grease in a cold pipe. And that is an image that's been pretty much running cardiology and preventative medicine for the last 70 years. But it was just made up. He never had any evidence to support it. And then after that was started, the advertising started. This is also propaganda. These are magazine ads for polyunsaturated fat, showing that, like all the health claims, like that if you're a responsible mother, you're going to feed your family polyunsaturates, especially grandma, because she's probably going to be inclined to try to use butter. And this one on the left is very interesting because it has this little cholesterol lowering diet. Like, oh, so it's very powerful. You need to lower your cholesterol, it's saying, by eating this beautiful yellow substance. And what is this little square at the bottom? Well, what it is it's a citation. It's a reference saying, if you want to know more about the link between these wonderful corn oils and being healthy, read this article here. So I'm going to show you this article just to show you that this is all propaganda, including the medical articles. So this was published in the Journal of the American Dietetic Association in 1973 by our friend Ancel Keys. His name pops up a lot in this sort of thing. And it looks like if you just cursorily read it, you're like, oh, trials and literature review of cholesterol-lowering diets. That's what it said it was about. Yeah, okay, great. Oh, and look, reduction. This is like if you're just not thinking. You're just reading it. Reduction in saturated fat and cholesterol intakes with increasing in polyunsaturated fat has been recommended for American diets, as if that's the case. It's been recommended by the American Heart Association, not by anybody else, Okay, that's important. So we're already with the propaganda. Studies reported and reviewed here show that such a change will reduce serum lipids. Okay, that's true. And hence, presumably, this is not true, the risk of coronary heart disease. Presumably, they had to say that because there was still no evidence, right? So that's what I mean by this stuff is propaganda. It's half-truths and innuendo. And it was so outrageous that prominent doctors back in the day tried to really warn everybody and speak out against what was happening with this campaign against saturated fats and for polyunsaturated vegetable oils. So this is a doctor, very prominent, respected physician who designed one of the biggest nutrition studies ever done in history called the Framingham Studies. It's still ongoing. It started many years ago in the 50s, and here's his thought after 20 years of the study. He says, after 20 years and several $100 million, we still do not see any convincing evidence in support of the supposed link between saturated fat and heart disease. Okay, so this is a guy who we should listen to, but lost in the winds of history. And fortunately, he's not alone. I mean, there are doctors who are not at Harvard, who are not affiliated with the American Heart Association, who are independent, not paid to say things, that are coming out and trying to continue the tradition of warning us against the propaganda. So this is an article that was published in 2017 in a British Medical Journal article, a well-respected journal, with a bunch of well-respected doctors at universities who say very clearly that it's a bunch of baloney about saturated fat being bad for you. Well, the actual quote is, despite popular belief among doctors and the public, the conceptual model of dietary saturated fat clogging a pipe is just plain wrong. So why is it that when you go to a cardiologist or a primary care doctor, they're still going to tell you you need to lower your cholesterol. They're still going to tell you you need to avoid saturated fat in spite of the absolute lack of good solid evidence? Well, it's this. It's because Harvard, the American Heart Association, have a complete lockdown on the nutrition conversation because they publish 13 different peer-reviewed medical journals, and each one of these pumps out dozens and dozens of articles every year, which is essentially little more than propaganda, promoting the health benefits of seed oils. They run the nutrition conversation. They are the press when it comes to educating medical doctors. And so it's just impossible for everyone to dig and dig and dig to get to the truth because it's been going on for so many years. It's difficult to actually not take these things at face value anymore. It's very hard to do the work that I just showed you, like in just one example here of Harvard, where they misname, the title itself is wrong. They're not comparing dietary fats. They're comparing mostly plasma fats to type 2, whether your risk of type 2 diabetes. So it's a lot of work to try to figure out if any one of the many, many articles that you might be reading is just pure propaganda or if it's worth something. But fortunately, and there is hope here, Google is really becoming a useful tool. It's helping us out because when you ask Google the right questions, the pointed questions, like has a link between saturated fat and heart attacks ever been proven? You find that everybody except for Harvard and the American Heart Association, which is basically the same thing as Harvard because their American Heart Association hires people, appoints people who have Harvard University jobs. and everybody but them basically says saturated fat isn't bad for you. It was never really proven, and contrary to popular belief, there's no good link, right? So we can show you even that saturated fat from the American Heart Association doesn't quite say here that the link has been proven. It says that it'll raise your LDL cholesterol. But that begs the question, so what? Because it's never been proven that high LDL cholesterol causes heart attacks. That hasn't been proven either. There's a very, very slight association, but what seems to really cause heart attacks is oxidation. And we know that cigarettes cause oxidation because you're smoking, and we know that seed oils cause oxidation because of their chemistry. So why would Harvard and the American Heart Association just be so steadfast and refuse to change in spite of the fact that it's almost like, to me, it's they're an embarrassment. As everyone else is saying the opposite of what they're saying now. Well, Nina Teicholz, who's also presenting at this summit, has done a great job in digging up the connections between the American Heart Association, Harvard, and big seed oil, because she found that there was a huge cash infusion, $1.7 million back in 1948 from Procter & Gamble, that pretty much launched the American Heart Association into the powerhouse that it is today. And Procter & Gamble, what do they make besides soap? Well, Crisco, which is made out of cottonseed oil, seed oil. And there's more to it. It gets worse for Harvard, really, and the American Heart Association, because actually the people who were telling us that saturated fat is causing heart attacks they actually knew. They were the only people who knew that there was a proven link between cigarette smoking and heart attacks that they kept secret. So back when Ansel Keys was in his heyday, telling us all about this is happening in our arteries, are clogging up like grease, thanks to all the butter we love to eat. He was declared Time Magazine Man of the Year in 1961. And in this interview, he says something I think really important that's been overlooked in terms of the history of culpability and whether or not it was a mistake or on purpose that Ansel Keys and Harvard are telling us about avoiding saturated fat. He says that I know other doctors are blaming cigarettes and stress and hypertension and lack of physical activity, all these other known and accepted risk factors today. But Keys downplayed that and says that the main thing is saturated fat. That's what he says in this interview. And a very interesting and telling quote here about the personality of this man and his devotion to his own cause versus the cause of human health is that is this interesting quote here at the bottom. Keys' chief weapon has been the sheer weight of solid statistics, and I say published where, says one Philadelphia physician who knew him personally. Every time you question this man, Keys, he says, I've got 5,000 cases. How many do you have? Which sounds like something a bully would say. And where was it ever published? They don't say here. So this was unpublished data at the time, and he was claiming to have 5,000 data points, all pointing to saturated fat. And he knew it was the biggest. He knew nobody else had that many because it's the biggest study ever done. What? Hang on one second. Where did those 5,000 cases ever get published? Well, in this thing called the 7-Country Study, which was published first. It was published many times. It was first published in the late 70s. And Ansel Keys was claiming that this data is why he said cigarette smoking didn't cause heart attacks. There's no evidence. But when this was actually published, it says that this study showed the importance of cigarette smoking in long-term survival, meaning the more cigarettes you smoked, the less you survive. You're more likely to have a heart attack. And the lesser contribution of blood pressure and very little concentration of cholesterol, serum cholesterol. So this means that Ansel Keys knew he was not telling the truth about cigarette smoking back in 1961. I mean, that's how I interpret it. I don't know how else you can interpret it. And so let's take a look at the history of the American Heart Association and what is their thinking on saturated fat. So here's like from their own webpage, things that they're proud of. They're saying that was a real big accomplishment in 1956 to go ahead and they say that there was no evidence against smoking, right? There was no evidence yet against smoking, right? The same study, the 7-Country Study, is where they got all their evidence. And from that same study, they apparently, in 1956, are claiming that they had a link to fat, to fat and cholesterol, right? So, well, okay, what does that mean? Well, actually nothing. It doesn't mean anything. So the studies that Keys is talking about, they linked fat to cholesterol. In other words, the more saturated fat you ate, the higher your cholesterol. But that's a big so what, because it didn't link it to cardiovascular disease, right? So this is innuendo. That's my point here, that the American Heart Association is guilty of propaganda campaign, and they are guilty of keeping the public in the dark about the health harms of cigarettes. This little circle's bugging me. They got money from Procter & Gamble in 1948. They started telling people to eat low fat in 1956, even before these 5,000 data point studies were started. Then they target saturated fat in 1961 when Keys says eat polyunsaturates. Nothing about smoking. The study was finally published, the 7-Country Study finally was published in 1978, where if you read the whole thing, you discover that smoking, not fat, is what correlated with heart attacks. But the American Heart Association did not say a thing against cigarette smoking until 1988. Okay, this is from their own website timeline. And how many people kept smoking in those 35 years that they actually had evidence that cigarette smoking was causing heart attacks and cigarette smoking wasn't very good for your health? How many people died because the American Heart Association wasn't forthcoming in their data? I can't think that this is some sort of oversight. I can't see that this is just an accident. I think they really don't care. And I think what they care about is finances. Now, why would there be, who would be protecting cigarettes? Well, here's something else a lot of people don't talk about when they talk about Ansel Keys. Ansel Keys invented the K ration that all of the military in World War II was fed on their tours. The K ration is what guys overseas were eating. K stands for Keys, as in Ansel Keys. They all had cigarettes in them, every single one. And every single meal, they got at least 4 cigarettes. So all the GIs came back hooked on cigarettes. And you got to believe that there was some money, like somebody benefited from that, and that there might have been some kind of relation. I mean, you have to be naive to think that there was no kind of beneficial kickback from the cigarette companies to Ansel Keys. Anyway, he I've shown you that he basically protected the cigarette companies here for 35 years to the tune of how many millions of people dying from heart attacks. I want to show you this. This is something else that Ansel Keys could have shown us, that Harvard could show us, that the American Heart Association could show us, and I could show you if I get my circle to move out of the way. So we're looking at three variables here. And again, this is correlation. We're looking at the gray line is cigarette smoking per capita. Very important to do the per capita because our population has grown. But as you can see, individuals were smoking many more cigarettes in the 50s and 60s. People were commonly smoking 4 packs a day. President Eisenhower was a 4-pack per day smoker. But cigarette smoking declined basically when this is sad to say, but all the people who were addicted to cigarettes by going, to the military started dying of heart attacks. And so cigarette smoking declined. So we have 1/6 the level of cigarette smoking we did, 1/4, I'm sorry, back at its peak in the 50s and 60s. And cigarette smoking line correlates with the heart disease deaths per capita line very closely. That heart disease deaths per capita line also peaks in the 50s and 60s and starts to decline by the 80s when cigarette smoking declines. So what's this third line? This is saturated fat consumption per capita. And as you can see, there is zero correlation. So Harvard is telling us to ignore these huge correlations between cigarette smoking and heart attack deaths and blame it all on saturated fat when there is zero correlation. You can't trust. How can you trust people who are clearly lying to you? I don't trust Harvard anymore. I see them as nothing more than a propaganda machine. Okay, now the last thought I want to leave you with is this, that the same people who are trapping us in this vegetable oil experiment that is changing the composition of our body fat and making us susceptible to obesity and all of these chronic diseases. The same people are blaming us for our illnesses. This article says that if you are overweight, if you have diabetes, it's because you're the problem. Harvard is behind all this, and they have the nerve to tell us that we are the problem when we've been doing what they said. They say the reason we need to gain weight, or they say the reason we're gaining weight is that we need to eat better. We need to move more. They say the reason we have diabetes is there's something fundamentally wrong with our genetics. They tell us that the reason we get heart attacks is that we're not adhering to their advice. But when it comes to fats, we've been forced to comply with their recommendations. So they're the problem. That's my message. You are not the problem. Your genetics are not the problem. Your willpower is not the problem. Harvard is the problem. Harvard and the American Heart Association and all of the other medical figureheads who are parroting the same failed advice. They are the problem, not you. And the first thing that you need to do if you want to take back control of your health and your life is very easy. Stop believing them and say goodbye to vegetable oils because it will save your life. Thank you very much for listening.